If you're thinking about plastic surgery, you know you're not alone. This is unbelievable. Cosmetic procedures have increased 305% in the last 4 years. That includes both men and women. 305% in 4 years. Joining us this morning, Dr. Robert Guida. He is here to tell us more about why this is occurring. We have a couple of guests with us as well who I have no idea, and I mean this, why they would even be interested in plastic surgery. They look great, look healthy, look happy to be here, but they are interested. We'll talk to them in a moment as well. But Doctor, what's going on out there that's skyrocketing these numbers, making it go up so high? So like 305% in 4 years. What's happening?
I know. I think people are aware that procedures are safer these days. The downtime is less, and people can have things done quickly with almost no downtime. There are procedures that are non-surgical that are very quick.
Non-surgical procedures?
Non-surgical procedures.
Well, let's start there if we can.
Right.
What non-surgical procedures are available?
Probably the most popular thing right now, and it's up over 2,000% in the last 2 years, is Botox injections.
We've talked about that many times here in the morning edition. That's the injection into the face to remove wrinkles.
Right. It takes wrinkles away. There's no downtime at all. It works dramatically. It does things that surgery cannot do.
But that's relatively new, isn't it? Are people
Botox has been around for several years.
But used in this way?
It's been used for the last 5 to 6 years for wrinkles in the face. The FDA just approved it for cosmetic purposes, but for the past 5 to 7 years, it's been used quite a bit for cosmetic reasons.
But you're comfortable with long-term effects of Botox? Do we really even know what any long-term effects may be?
Well, it has been in use for about 10 years, and it's almost complication-free. It's very safe.
No kidding. Well, that's certainly some interesting. We're going to talk about surgical procedures in a moment. Let me bring in our guests here. Karen Parzial.
Hi.
Hi there. And Andrew Wardell are here. Now, Karen, you've had Botox done,
Yes.
correct?
And I liked it very much.
Yeah? Tell us about it. I mean, first, why? Why did you feel it was necessary? And like I said, you look fine to me, so maybe it did work. Was that not the case earlier where you felt a little uncomfortable?
Well, I have very deep frown lines right here, and so when I got it done about a year ago,
Okay.
Dr. Guida actually did it for me, and I liked it. It just kind of made it very, kind of wrinkle-free. So I liked it. I thought it looked younger.
No pain or anything like
Not
that
at all.
involved? It was a very
Great.
comfortable procedure?
very.
And it worked out well?
I did it actually during lunch. It was great.
No kidding. Just during lunch,
Yeah.
went right over, and
Yeah,
that was that.
that's it.
No kidding. Well, that's impressive without question. Let's bring up some statistics we want to show the folks at home dealing with some other procedures that are out there to show the numbers and how much they are increasing, including for women, liposuction, breast augmentation, and eyelid surgery. All of these up dramatically, correct?
Yeah, they're up dramatically because the procedures have changed. Liposuction, eyelid surgery, the downtime is usually less than a week. There's a misconception that you're out for 3 or 4 weeks, but it's really not that way.
Well, I'm hoping we can show the numbers to the folks at home. If not, I'll tell you about it. But liposuction is up 390%?
Right.
Why is that?
Well, there's a lot of media attention to it. People are much more aware of the procedure. It's become much safer. We know the liposuction works better in people that aren't really heavy. They just have isolated areas of fat. So if people are healthy, but they have fat pockets, and it's much easier to recover from something like that.
Just to let you know, breast augmentation up 413% in women, 137% for eyelid surgery. But 11% of cosmetic surgery is done on men. And in this case, we want to bring in our male guest, Andrew Wardell. Now, Andrew, tell us what you had done and why.
I've not actually had anything done, but I'm contemplating it.
Oh, okay. How come?
I'm 56 years old. I have a 5-year-old daughter, and I'm tired of being asked if I'm my child's grandfather. I'm also going back into the workforce.
People have the audacity to ask you that to begin with?
Oh, yeah.
Oh, this is Jersey, so people just come out and say what's on their mind, so I can understand that. But what are you specifically looking into at this point?
I'm inclined to frown a great deal, and I get lines here, and that's something I would like to address, and possibly around my eyes, too.
That being the issue, doctor, how would you address that one?
Right, looking at Andrew, the simplest thing, the thing with the least downtime and probably the least expensive is Botox injections.
Okay.
They'll take care of the lines in his forehead, the frown lines, and it's very quick. You get a quick result.
Liposuction, eyelid surgery, nose reshaping up for men significantly. There's a number for you, folks. It's 212-871-0900, a website there for you as well if you're looking for more information.